All right. Hi, everybody. Welcome to today's webinar. We will go through intros here in just a sec, but you know you're in the right place if you're ready to learn about mental health, and more specifically, mental health that actually works and some proactive mental health. I'm already seeing some emojis flying, some engagement from our attendees, so huge fan of that. A couple quick housekeeping items before we get going. There is a chat, there is a Q&A, so please feel free to throw your questions in there. Megan Anderson from Ethos Benefits will be monitoring the chat. If there's something that she can answer, she'll probably just respond right back there. Otherwise, she'll either interrupt or wait for the end and we will get to your question. So without further ado, let's get going. Johnny, do you want to start with your intro?
I'm down. That's a great headshot, Chelsea. Jeez.
I
Uh,
actually was telling somebody earlier, I'm like, it looks like my face is frozen. Like somebody did something wrong here, but that's okay. Go ahead.
no, we're sharp. I like it. I'm also impressed that like 17 people were here on time and not like in between. I don't know about you guys, but a lot of times I'm like back to back and then I need to ask for permission for a bio break at the top of a meeting because I didn't budget time. So kudos to the 17 people who like, I'm going to be there on time. My name is Johnny Crowder. I'm the founder and CEO of a mental health company called Cope Notes. And um, just briefly, how I got into this work is I grew up with severe mental illness. I resisted help at all costs. So I didn't want to talk about it. I didn't want to take medication or go to therapy. I didn't want to read your books. I didn't want to download your apps. It was like I just hoped that it would go away and it never did. So I started treatment in high school. I went to UCF actually for psychology, and I started working with the National Alliance on Mental Illness, doing peer support and public advocacy, and became really passionate about just recovery. And so now it's funny. For most of my life, you couldn't pay me to talk about mental health, and now it's my whole job. So I'm very grateful to get to do this work because it's affected me and my family personally. So it warms my heart to see people making this a priority and talking about this in the workplace because that was one group of people that I never told I was struggling, was the people I was working for and working with. And I think there are a lot of people who aren't as lucky as me who, because of that silence or because of the lack of resources, don't get to live the life that I get to live today. So I take my work very seriously for that reason.
Love it. I'm very honored to be speaking alongside you today. Hi, everybody. My name is Chelsea Reikus. I am the president and co-founder of Ethos Benefits. We are a employee benefits advising firm. We support mid, large market employers all across the nation. We're different than, I would say, 99% of brokerages in the market. The reason that we exist is we are actually trying to get to the root cause of why healthcare sucks and why the 181 million Americans relying on employers like you are struggling every single day despite having insurance. We do that through a fiduciary advising approach. So, no commissions, no bonuses, no misaligned incentives, just real advice, real problem solving. My first interaction with the healthcare system in the US, I am Canadian, was actually when I suffered a brain injury in college playing college softball. So I was playing NCAA Division One softball, got hit in the head, cleared to play too soon, and then hit my head again the next time that I played. Had to defer med school. Thought I was going to save the world as a doctor. Obviously, that didn't happen. Went back home to Canada, did a brain injury rehab program, experienced a lot of mental health issues during that part of my life. And what was interesting is at that point, I experienced what 1 in 12 Americans experience, which is medical debt. So even though I went to Canada, those first few hospital visits were in the US and those bills followed me. Like 1 in 12 people, I thought I had insurance. I thought it was covered. You're 22. What the heck is a deductible? Your brain isn't working right. You can't work. It was a very challenging time. So because of that, not only am I really passionate about fixing our healthcare system, but especially passionate about mental health coverage and making sure employees, whether they're my own employees, like some of the folks you see here on the call today, or the employees that we serve through employers like you, that they truly are supported in their time of need and it's not just talk or fluff or something on a benefit guide. So, what are we doing today? The whole point of today is to talk through insights and strategies that will strengthen the workplace mental health and not I sometimes I get really frustrated honestly with mental health conversations because it's so foo-foo and high level and it's like, well, have a good culture, make people feel supported, help them be seen. And it's like, well, how do we do those things? Right. And then more importantly, and Johnny's going to cover a lot of that, like how to make this a simple, daily, accessible piece for employees. But more than that, how do we take it a step further and finance it through plan design with your employee benefits? That's the second thing we're going to cover. So, getting into why it's not working, I don't think anyone on this call is going to be surprised by this. But did you know that there's burnout, attrition, absenteeism? If you're in HR, which most of you on this call are, or CFO, you are well aware of these problems. And we're going to dive deeper into the stats here, but there's a huge underutilization of EAPs. EAPs are employee assistance programs. The adoption of EAPs since COVID, I have the stat later in the presentation, but it's 88% of companies are offering EAPs, employee assistance programs. The utilization rate of something like that is usually less than 4%, which is very, very, very low. Sometimes it's even as low as 1% in some studies. And then there's a lot of cultural and structural barriers to mental health support on the daily. So, how bad is it? 85% of workers report experiencing burnout. 47% of them have taken time off for mental health reasons. Companies with high burnout levels, obviously, we know this. We see 23% more absenteeism. We're not even talking yet about the cost of turnover, right? Oftentimes, if you own a business like I do, you know that there is a cost of turnover, whether it's 1 to 2 times the salary that you're paying. The interesting thing is the high burnout levels actually correlate to 3 times higher healthcare costs, specifically medical claims and pharmacy claims. And then US workers with fair or poor mental health miss nearly 12 days of work that are unplanned throughout the year. Don't we love those, right? Those suck, but people need them. But what's interesting is that healthier peers are only missing 2.5 days of unplanned absences. We were just asked if the audience will get a copy of the deck. Absolutely, you will get a copy of the deck. You'll get an email tomorrow with a bunch of stuff. And then let's talk a little bit more, less about the human impact, more about the financial impact. And then we're going to hand it over to Johnny. Replacing employee exactly costs 50 to 200% of their annual salary. So if you're in a high churn business, it's very, very expensive, right? 29% of absences are actually due to mental health issues, whether people are telling you that or not. Burnout related absences are averaging 4.5 days per year. If I know for our company, for example, we have 15 days of PTO plus 12 holidays, right? So we're somewhere near about a month of time off. That's a lot. If 4.5 days out of that 15 is dedicated just to mental health on average, that's quite a bit of that time off. And that's not really time off, right? I'm dealing with a crisis and I'm not productive. So 98%, this is that EAP stat, of companies that are mid to large throughout the country are offering employee assistance programs with 4% utilization. So we're going to talk a lot more about that. But let's first talk about microdosing, mental health at work, and what that would look like. I have one comment, which is the last time I heard microdosing, I'm like really curious what everybody else is thinking when I say microdosing. I just recently was at a conference and there was a vendor there making a play for microdosing of, oh my gosh, it's escaping me, but it's like mushrooms, basically. It's ketamine therapy as a new mental health benefit that's entering the employee benefit space. So conversation for a different day, but it got me going. All right, Johnny, your turn.
Yeah, I find it really interesting that we treat mental health as so different from other forms of physical health. Like we rarely say about vegetables. We rarely say like, well, I don't really ever eat vegetables, and then maybe once a month I'll eat like 3 pounds of green beans and hope that somehow that undoes everything. Or like, yeah, I don't really work out, but then like uh maybe 3 or 4 times a year I'll do like a really hard workout, and then I hope that that kind of makes up for the rest of the year. And that's how we treat mental health. We're like, yeah, I don't really go to therapy, and then maybe if something goes wrong I'll use my 3 or 4 EAP therapy visits if I can find someone who will accept the credits that I have. And I just think that that approach is very wrong. Some of the healthiest people I know are just people who walk every day And it's like, it has to be more complicated than that. But if you look at the research, like people who walk more are healthier. And I think we've really sort of overthought and overdressed um, what mental health has to look like in our life. We think, I know for me, so I grew up with severe mental illness. And when I considered treatment, I was like, treatment?
Yeah.
Oh man, I'm gonna have to share all this personal information. I have to go book appointments and take medication. It's this huge, intimidating lift that I built up in my head. And I think there's not only is there in school, I studied abnormal psychology and neuroscience, and I was really fascinated by how and why the brain changes. And a lot of the research is we think we change like, oh, it was when my grandma passed away, and that's when everything changed. But most of the change that happens in your brain is really slow and incremental. So just like we didn't all of a sudden become engaged in an unhealthy coping mechanism, it's not like one day oh, we never had anger issues and the next day from then on we did. It was gradual. I also believe that recovery is that way. So really our whole approach at the company that I work at, Cope Notes, the whole idea is that we are taking these small steps in the right direction over time and building consistency in habits and patterns. And I think not only is there science that backs that, which you would hope that, but also I think it just makes rational sense because we don't view any other type of health as these like radical shifts immediately. We know that things take time.
And if we do view health through that lens, it's often going to result in catastrophic, more high cost claims, right? As opposed to being more preventative focused for sure.
Yeah, I get really, you said that you can get pretty sort of like my friend calls it righteous indignance, and it's like you're so frustrated because something is so wrong.
Yeah.
And that's how I feel about a lot of folks when they're thinking about employee benefits. They say, well, listen, if 4% of our people are going to use the EAP, then let's just focus on the 4% of people who are actively struggling and willing to reach out for help. And I'm like, buddy, there's like
Missing the
10
point.
people. So I always tell people a few things is number one, if we're focusing on only the people who are actively struggling and only after they've reached out for help, we're completely neglecting prevention. So it's kind of like waiting for you to blow a tire to be like, oh, I should have replaced my tires. Like actually it's did this just happen to you, Chelsea? Is that why you
Not the tire, but I'm thinking about it from like a medical claims perspective because I see a lot of HR and I see a lot of actually our clients on here. And I want to like bridge another example. Let's say that in our claims data, because we have a transparent data-driven health plan, hopefully, we're seeing lots of diabetics, right? We're seeing that people are taking insulin, and a lot of vendors out in the space of employee benefits are focused on diabetics, but they're meeting them like after the diagnosis. And there's this whole population that's not going to be coded as a diabetic yet, but they're pre-diabetic and they're showing maybe it's being coded as hypertension. Like there's all those preambles to full on diabetes, obesity, whatever it is, heart disease, things like that. That if you have access to data and you're looking at those precursors, you really, of course, we want to target the people who are already sick, right? Like we want to make them feel better with the diabetes management program. But why would we wait for these guys to get here when they're high cost claimants? Why wouldn't we start down here? So I just wanted to make that parallel with other medical type benefits that people seem to be able to kind of wrap their head around more sometimes.
It's funny. I had an employee a couple of years ago, and when she joined, she said it was her first time working in behavioral health specifically, and she was like, "You know what? I've never understood. All this time we were onboarding her, she's like, I just have one question. Why is like the whole employee benefits industry focused on fishing people out of a river and like throwing them like life preservers, and no one's going upstream and like putting a fence up so that people stop falling in the river?" And I'm like, that's such a good analogy. So basically everything we do is in the spirit of prevention. I actually think whenever I meet with an employer, I say, right now, most of the benefits that you're offering, if you are, I pray to God you're offering mental health benefits. And in all likelihood, the ones that you are offering are designed to help the small percentage of employees who are actively struggling with something and willing to reach out for help. And I'm like, why pay for a benefit that only a small percentage of people are going to use at potentially 12 or 24 months after they could have really benefited from it? So my mentality is, in a perfect world, everybody would reach out before they needed help and they'd feel
Mhm.
comfy and they'd have resources. But my whole approach, like I'm a suicide survivor, And I'm so grateful that I'm still alive. And I'm grateful for all the help that I received after my attempt.
Right.
But I think, when I really could have used support is before the attempt. And I was not vocal about what I was going through before that. So I think if I'm an employer, I want to provide support for not only the people who are in the middle. My pastor says you're either in a storm right now, you've just exited a storm, or you're just about to go into a storm, which is 100% of people. So I view mental health the same way. Either you've been through something really difficult, you're about to go through something really difficult, or you are going through something difficult. And I think the idea that I try to tell people what mental health should be viewed as a vitamin. Like everybody brushes their teeth every day. Hopefully, all your employees brush their teeth every day. So I would view it as like your whole employee base needs a toothbrush and floss. Do they all need root canals? Probably not, but they all need a toothbrush and floss.
I really love that. So tell us a little bit more about why you feel like text message, like daily microdosing text message, is a way to hit even, the engaged population, but also the unengaged population.
Yeah, there are a few reasons why I really believe in SMS, and I have like staked like I'm a believer in text messaging,
Me too.
um, and
To a fault.
there's a few reasons why I really believe in it. Number one, um, I totaled my car and I went to a Copart yard where you have to like pick up your belongings from the car. And I had to download an app to log in to a line that nobody was in so that they could call me up to a desk.
No.
I had to download an app, create an account, enter all my information, and then sit in a chair for them to say, Mr. Crowder. And I'm like, you could have just said that.
We've
And
been
it
looking at
was
each other for 30 minutes.
I have had so many experiences like that where apps became a barrier. We think that by making things high tech, we're making them more accessible. I think if you surveyed the general population, we don't. I'm at a conference right now and I did not download the conference app because I don't want another app on my phone. So I think we've sort of over tech we've
Overapt.
made we've absolutely over apped. And SMS, I think what's really important from a psychological perspective is when you get an app notification, your brain primes itself to receive marketing materials. So, like when I get an app notification, I know it's also going to 200,000 other people with the same app. It doesn't feel personal. So, my brain primes itself differently, sort of like when you read a billboard or watch a commercial. But
Mhm.
when you receive a text message, your brain primes itself to receive a message from a friend or family member, someone that you know and trust. So, there's part of it is like the way that people interact with text messages is just different. The second, this is a really common misconception. Everyone's like, yeah, text messaging is good for my kids. Get real. Get real. My mom texts more than I
Oh,
do,
yeah,
and
I
she's like
know.
65. So don't try to give me this that's good for kids. And in fact, 97% of American adults prefer text messaging to any other communication method. So quit kidding yourself. Maybe you're part of the 3%. But the fact is, not only is it far more effective, like it's 50 times more likely that you read a text message than an app notification, but it's also the most preferred method of communication. But the third is, and this is, I see employers get this wrong a lot, by the way, just because the C suite or leadership or the admin and HR people all have smartphones and all live in relatively urban or suburban areas, they assume that the rest of the employee population, oh, yeah, I'm pretty sure everybody has smartphones. Wrong. 11% of the US population uses non smart cell phones. So you could have an extraordinary mental health app. And if you're talking about tens of millions of Americans not being able to download it, it's not doing any good for them. So I am very passionate about removing barriers to care and making it accessible. Like there are people like my dad is 73. He has a smartphone, but you could not pay him to use the smart features. He cannot. So I'm a believer in like keeping it simple, just like a text from a friend or family member that you can read and respond to if you choose. I want to remove all the bells and whistles and just make it work. I don't need it to be fancy. I need it to help.
Yeah. While you were talking about that, so about 2.5 years ago, maybe 3 years now, we adopted and internally for our clients and for the way that we service employees. So we're very white glove, high concierge. We're booking appointments, we're calling providers, we're doing all the things, right? It's not call a 1-800 number. We're even going as far as like if we see a medical claim come through and then we see that this person also has an accident plan and it looks like it was an ER visit and a broken bone, we're going to proactively reach out to them. We realized that text was the way to do it. And the cool thing is the text system that we use, it sounds like very similar to probably what you use, which is you click the link in there and it opens up into like this portal, but it doesn't require any sign on. So no sign on, no password, no app. And it's really that, especially for construction groups or, groups where employees are all over the country, deskless workers is really like the proper term, I suppose. But and then also just add dependents. There's so many amazing things that we've been able to achieve in terms of employee communication and engagement with this text messaging software. So I'm not surprised to hear it all. The stats you said, I didn't know them. I've just seen in our business, like, problems get solved way quicker. And then they're not going to HR either, right? They're not like, hey, I'm having an issue. They're like, oh, and then to your point, they don't want to talk to HR about mental health stuff either. So I can't tell you how many times we've gotten texts from employees that say, I need help setting this mental health appointment. I know Megan on my team has dealt with that multiple times. And it's a text that goes directly to her. It's confidential. She helps them out.
Yeah, the funniest part is like, when we're trying to we work with employers on mental health benefits and rolling them out and culture. And sometimes they'll be like, I don't understand why no one's signed up. And I was like, well, what's your process? How are you sharing it with people? And they're like, well, I have a sign up sheet right there on my desk. And you just have to put your name and your employee ID and your department and then you just sign up. And I'm like, you want these people to walk in your office and fill out this form? Like there was something so it was like, oh, you've obviously never had to seek help before.
Yeah.
Because it takes at least for me, it took all the courage in the world to sign up for something. And that was with nobody knowing. That was just me doing it alone in my bedroom. So imagine walking into a leadership, like someone with a leadership position, and requesting. I've actually heard people say, yeah, they just have to come into my office and let me know that they need it and I'll sign them up. And I'm like, that's a gnarly system.
Not going to happen.
Yeah.
Yeah. Did you want to talk on any of this here?
Yeah, I'll be really brief about. I've attended a lot of webinars. I've been a part of a lot of webinars. I never want anything to feel like a commercial. Like I genuinely want people to learn if they are spending an hour with us. So I'm going to try to keep this as like science focused as possible. There are four main benefits to what Cope Notes does as an organization. So I'm framing these as like, here's why the science is important and not here's why you need to buy Cope Notes. I just care that you implement something. If it happens to be Cope Notes, great, because I believe in it. But I just want you to leave going like, I never knew that. So the four main tenets of what we do at Cope Notes. The first is every message that we send is written by a real peer with lived experience. So I am, just so you know, I'm a certified recovery peer specialist, which means that I have lived experience with mental health conditions. I did a bunch of hours, like a couple thousand hours of training and peer support, earned a certification in like how to support other people who have been through similar challenges. And the value of peer support is like right now, if I have a friend who's been through a miscarriage. And if I try to console or comfort someone who's been through a miscarriage and I've not been through a miscarriage, it can be helpful, but not the same type of helpful as someone else who has been through a miscarriage. There's something so unique about that type of challenge that makes the peer support really valuable. So if someone's going to provide me support for anxiety or depression or OCD or bipolar disorder, I'd really like to hear that from someone who understands what I'm going through. So the nature of peer support is I'm using my lived experience to support you and empathize with you. And I clarify this because like I said, we're at a conference right now. The vendor to our left and to our right are both like AI behavioral health.
Oh no.
Like the messages are written by AI, like it's like a smart counselor. And I'm sure there are benefits to that. I'm just clarifying this is not that. Our messages are written by real flesh and blood human beings with heartbeats who have been through difficult things. And they're not just writing like smile or like have a good
Live,
Wednesday,
love, laugh. How about that
Kelsey.
one?
That's a good one. We need to incorporate that into our
You're
text library.
welcome.
Yeah, I'm gonna steal that. We all of the messages that we send are based on proven psychology. They're coded to proven psychological principles. They are reviewed, edited, and approved by clinicians. So these messages could be a psychology fact, a journaling prompt, an exercise. But I think what's especially cool about this is not only are the messages written by real people, reviewed by real mental health professionals, but they're also delivered at random times, which means right now, like Megan could sign up and she would get different messages than Chelsea every day at a different time every day. So no two people ever get the same text at the same time. There's some really cool neuroscience behind this that I think we have a slide for. And then the bottom right, you can journal back and speak freely. So, like
Mm.
Chelsea, like you were saying, if someone doesn't feel like hitting up their HR person, they can send information into, they can basically text in their Cope Notes thread and use it as a journal. And the
That's
reason why people feel safe doing that is because on the bottom, you'll see it's 100% anonymous and confidential, which is a huge differentiator. You will hear that resources are confidential. It is rare that you find a mental health benefit that does not collect PHI, so protected health information. Like we don't, like Chelsea, you could sign up right now and I wouldn't know that you did. Like I actually don't know if you're subscribed to Cope Notes or not.
I am,
Because
and I have been for about a year.
I literally didn't know that. We did not stage that. I actually didn't know that
No, yeah,
because we don't collect names. We don't collect like your health data, your
not selling it
demographics.
to anybody.
Correct. So we're very big on privacy, and you'll notice there's this like there's a human element to everything we do, and that'll basically every time I speak on this webinar, you'll kind of hear that, and that's from that peer perspective.
Yeah,
Yeah, this is. Can I go off, Chelsea?
go off.
This is the
We're free reign. Be big.
okay. So I'll try to keep this short and sweet, but if you've been multitasking, stop.
This
Like
is where
put
you
down
should
your
listen.
phone. Yeah, for the next 45 seconds, I need you here with me. Um, the science behind what we do is absolutely the coolest part of what we do. So it's called ecological momentary intervention or EMI. And the idea is that we are taking these this health education content, like these psychology facts and journaling prompts, we are taking them out of a clinical setting, like let's say you're sitting down with your therapist and you're taking clinical learnings from therapy. We're taking that out of a clinical setting, we're chopping it up into bite-sized pieces, and we're delivering it in non-clinical settings. So this is maybe today's text comes in while you're at work. The next text tomorrow comes in while you're making breakfast. The next one you're stuck in traffic. The next day you're sitting on the toilet scrolling through TikTok or something, and you get this text popping up on your phone. And these randomly timed interventions are actually proven to interrupt something called automatic negative thoughts. So our brains, roughly 80% of the thoughts we think on a daily basis are negative in nature. They are protective. So like, oh, that guy's standing a little close to me on the elevator, or like, oh no, I hope this client doesn't mind that I was a minute late to our Zoom meeting. Like thoughts like that. And what we do is we are professional thought pattern interrupters. So we interrupt that automatic negative thought with catalysts for positive thought and health education. And what that actually does is it trains your brain to form new neural pathways associated with coping skills and resilience. So we kind of jokingly say Cope Notes is like brain surgery without the scalpel, because what's happening is synapses in your brain associated with negative thought are actually migrating away from each other with these interruptions. And then a synapses associated with healthier thoughts actually have a chance to grow closer together. So I gave a whole TED talk about this. It's on our website, but this is like my favorite topic to talk about. If you can't tell, like my cheeks hurt, I'm smiling so much. So I need to stop so that we can get to the other slides. But in Q&A, if you want to talk about like synapses and stuff, I'm your man.
He's like, let's go. No, that's amazing. Do you want to share just a little bit about like impact for employers who have, and actually, I don't know if the chat's going to everybody, but there's some employers here who are clients of yours that are sending raving reviews, which is pretty
I didn't
cool.
know that. That's so
Yeah.
cool. I'll Venmo you guys later for saying that nice stuff.
Staged, obviously.
Yeah, that's so cool. Yeah, the impact of what we do, I mean, we're really outcomes driven, right? Like if you make a great mental health resource, I think it needs to do two things. Number one is the thing that you'll think it needs to do, which is it needs to decrease depression, anxiety, and stress. Like if it's a mental health resource and it doesn't decrease depression, anxiety, and stress, you messed up. Like go back to the drawing board. The good news is that we are evidence-based, published in medical journals. We've proven time and time again we have a couple hundred enterprise level partners. So we've done this over and over again, literally all over the world, to show decreased depression, anxiety, and stress for people who experience moderate to severe symptoms. So these are people who might be diagnosed. These are people who acknowledge, like, yeah, I'm going through something challenging. Every mental health benefit needs to be able to do that. The second thing that I'm very passionate about that a lot of people neglect, and is kind of the whole point of the conversation we're having, is on the left where you see it says increased. This is what employers should care about. Everyone's focused on the right, and I don't think that's wrong. People should be focused on decreasing depression, anxiety, and stress. But where it says on the left, increased resilience, emotional intelligence, focus, and coping skills, these outcomes were measured for people who are not living with a diagnosis. These are people in the mild to moderate symptom range. Many of them are generally living a healthy, unencumbered life. If I was because I am an employer, but we have a small team. If I was an employer who was in charge of a larger team, I would think more about these people, these outliers, the hundreds or thousands of people at your organization, maybe dozens. I don't know the size of your organization, but the people who aren't the squeaky wheel, like the people who say good morning and show up on time. And those are the people
The ones
that
we
if,
love.
that if you help them today,
Yeah.
you prevent them entering the moderate to severe symptom range in the first place. And that's my whole heart for this. We have to help people who are struggling, of course, but man, do I want to get there 12 or 24 months before they really struggle and keep them from ever entering that category in the first place.
And we're going to go through a case study here in just a second that's going to show when an organization takes this super seriously from a health insurance plan design perspective, what that kind of looks like to catch it early and the impact that it has on the cost of claims, which I think all the employers on this call probably know that when you are given a renewal increase year after year, if you're in a more traditional model, that's probably what's been happening. Anywhere from 5 to 15%. A lot of the times you're told if it's single digits, you should be happy, you did really good. I don't subscribe to any of that. There's a totally different way to approach the problem. And all we have to do is focus on the cost of care and claims, right? So if we know claims are driving premium, then we need to catch these claims earlier. And obviously, we're talking about mental health today, but that applies across the board. So we're going to talk through a case study. One of my clients, they have about 350 insured employees. The industry is construction and manufacturing. This data is 2.7 years of utilization. So, relatively strong statistical weight and insight into the population-wide management. So something that's interesting, and Johnny, you may have said this already, but every dollar that's invested into mental health generally yields about a $4 return for organizations. Something else that is kind of random but interesting is mental health claims accounted for approximately 10% of all disability claims in 2023. I know one of our attendees here is an HR at one of my clients that handles just disability claims, and I'm sure she would agree with that stat there. So let's talk about typical plan design versus the case study plan design. So in a typical plan design, you're going to see mental health copays, right, for outpatient visits, anywhere between 25 and 75. I've seen it as high as 150, unfortunately. Not something that we recommend. In this case study, I'm just going to, spoiler alert, everything was free for mental health. So quite literally, there were no barriers in terms of prior authorizations, session limits, networks, and literally no fee, whether you were hospitalized, inpatient, or outpatient, simple talk therapy, telemedicine, behavioral health kind of talk therapy, every version of accessing mental health support, no employee copay, coinsurance contribution at all. But again, let's talk a little bit more about what's traditionally happening in most plan designs. Coinsurance, especially obviously outpatient, you're going to be seeing 20 to 40% after deductible. Session limits. So this is kind of interesting because Johnny made a comment on one of my LinkedIn posts about this. I had this listed as 6 to 12 sessions per year because of the research I was doing. That's kind of what I was finding. And he was like, I haven't seen them that high. And, it kind of depends what part of the country you're in, obviously what carrier you have, that type of thing, but definitely not seeing a lot of unlimited sessions. And if you are, it's usually only virtual. And it's not guaranteed that you're going to see the same person and develop that really important therapeutic relationship with one person that you trust. You might be able
And
to call in anytime, right?
Chelsea, just to quickly share a couple really interesting statistics about session limits. So on average, 40% of all EAP sessions that are booked are canceled before they actually happen.
Wow.
Uh, so just to let you know the self stigma that goes into booking is I can come up with a reason to cancel a therapy session. Believe you me, it's like, oh, it's raining or my fish ran away or something. Like I can find a reason. But then of people who start, actually more than 50% of people who start quit after 3 sessions. And sometimes this is because of a term limit, like a plan limit. Sometimes this is because they're discouraged because they're maybe not making as much progress as they hoped or they're not connecting with their person. But this is the statistic that I think really matters here. On average, it takes 10 sessions to see measurable results. So, regardless if your plan limit is 3, if your plan limit is 6, if your plan limit is 8, in my opinion,
Not
all
enough.
of you are stopping short. It's like going to the gym for a month and being like, well, I'm not seeing the results. And it's like, because you only went for a month, you need to stay for longer. So I just want to point out that we're not advocating for like a certain number of sessions or 3 is better than 6. It's like really the point is you need to stay long enough to see the benefit. And a lot of people aren't able to.
Exactly. And what we're talking about here today, so this kind of side by side is with regards to like a health insurance plan, right? EAPs are usually going to be something that a company is adding on, usually tied to like an employer paid life policy or an employer paid disability. That carrier is like, oh, by the way, if you buy all this other stuff, here's an EAP for your employees. We've got some comments in the chat. I don't know if they're going to everybody or just to us, but about how those often have 3, to Johnny's point, limits per visit or per incident. And it's often very confusing. They often have to call a number and then give like an employer ID that nobody ever gives them, by the way, the employer ID. So there's a lot of barriers to this EAP access. Or if they're not using a text message type system like we are, where they have immediate access to their account managers, they somehow have to find that 400-page benefit guide from open enrollment. And yeah, it's not really working. What's really interesting when we're looking at the health plan design, though, is most of the time there's going to be pre-auth required for specialists or intensive care. That's another barrier. And then provider networks. That's something we're going to talk a lot about today because there is a serious shortage in this country from a network perspective for mental health or behavioral health. So what this group did, this employer, again, they did quite literally $0 mental health. And that's how we marketed it to employees during open enrollment throughout the year with proactive text messages. It was free for you and your family. So 100% of claims, which was just under 600 over the last 2.7 years, were covered with 0 member, right? And again, unlimited number of visits. So again, it removed financial barriers, which allowed employees to seek timely and consistent care. To Johnny's point, if we know it's going to be 10 sessions, the interesting thing is the average sessions for this group was 14, which goes right in line with your point of, it takes 10 sessions to see improvement. With this group, the average was 14. We had 41 unique employees actually use the mental health benefit, which was 12% of the population compared to the 4% of a traditional EAP type usage. And then services included everything from routine talk therapy to partial hospitalization. And then the common diagnoses that were treated, we had just under 200 claims for anxiety. We had 139 claims for life stressors, more of that kind of talk therapy counseling support, and then 76 different claims under bipolar. So it wasn't just talk therapy, which is what you're going to be getting through more of an EAP. It's real, like Johnny said, if you're not addressing anxiety and depression, you're kind of missing the point. So at least we know that that is being utilized here. So did it work, right? Did this investment work? And what was the investment? The total cost for this employer to make mental health completely free over almost 3 years was only $76,000, which is nothing compared to the total claims cost, which we'll talk about. The interesting thing here, average cost of each mental health claim was $129. National benchmarks are well above 200. So we were, with our plan design and everything, actually getting care at a lower cost which is the most important part of designing these health plans. The annual plan cost, so if we were to look at each year, what is the employer spending on mental health? About 28,000. When we compared that to the total amount of paid medical and pharmacy claims, it was 2.2% of paid claims. So absolutely nominal in comparison to the rest of the claim spend. But here's the really cool thing. This company was recently awarded the USA Today Top Workplaces for 2025. They rank in the top 1% of trust in the leadership at that company. They have quite literally 16 different badges on their email signature, like from employee surveys and awards through the state of Florida, all over the country, for their culture and their leadership. Is it 100% because we made mental health free? No, it's not what I'm saying.
Yes.
Absolutely.
Nothing else.
Exactly. It's all us. No, it's not. This is just one piece of an overall puzzle of culture that they have that's really employee centric. So for this 350 person insured group, it worked out to be less than $7 per employee per month that was going towards mental health, when it was obviously high impact, high utilization, it's working. Versus if we look at traditional industry benchmarks, where you remember that chart we looked at, more of that traditional plan design, we're seeing that mental health is costing $14 to $17 per employee per month. So a lot of the times we think that we need to spend more money to get better results, to get better care. That could not be further from the truth when we're talking about healthcare, and clearly mental health here. All right, so we're going to switch gears a little bit. So not only this was about it being the right thing to do, right? From a culture perspective, invest in your people, do the right things. It's great. It actually yields an ROI, right? It's not just a money pit. But there's a whole other side to this conversation about legislation. And if you're familiar, there's something called Mental Health Parity and Addiction Equity Act. Started in 2008, and then the Biden administration updated it in 2024. And since that update, this is a very hot topic with regards to compliance for employee benefits. So it's a federal law, and it's basically saying that your mental health and addiction treatment under your health insurance plan design must be treated the same as the physical health in the insurance plan. So you need to have the same copays and deductibles, right? So you couldn't have like a PCP visit at $10, but you got to pay 75 to go see a therapist. That is a total no-go. You need same visit limits, right? You can't have X amount of physical therapy, but you can only have 3 outpatient mental health visits. And then you need to have the same pre-authorization rules. So which employers actually need to follow this? If you have more than 50 employees, smaller employers may be exempt, but look at your state laws and double check. And then some exemptions apply for self-funded church plans or grandfathered plans. But it's really, really good common practice to take a look at those health insurance type medical coverages and compare them to the mental health. So do not put stricter limits on accessing. And then the bigger kind of worry in a lot of these things is the actual network piece, which we'll talk about here. And actually, we'll talk about it right now because there's a 2024 class action lawsuit that's alleging that Anthem Blue Cross of New York is maintaining a ghost network, which, if you know, there's a lot of lawsuits happening right now around ghost networks. So basically what happened is the carrier is saying, oh, we have this huge network for mental health providers and behavioral health. And, they get a bunch of new business because of this robust network that they have, but they actually don't have the providers in network. So whether they're straight up lying, they're no longer accepting the insurance, they're coded under the wrong specialty, the doctors aren't accepting new patients, phone numbers are inaccurate, they're getting disconnected when employees are calling, and sometimes the doctor doesn't even exist. But if you look at the provider directory online, it looks like this employee has 500 options for mental health providers. So these attorneys in this class action lawsuit called the 100 providers listed in the Anthem directory. Johnny, do you want to guess how many appointments they were able to make after making 100 phone calls?
I don't know. What's the time horizon? Like, are you booking a month out, 3 months out, 10
Well, so
months
that's
out?
a whole other conversation, right? This
Yeah.
is just, did the provider actually exist? Did they pick up the phone and were they willing to make a appointment?
I
But you're
mean,
right.
I've had this issue with like general practice doctors, like just booking an annual wellness checkup. I'll call and either it rings forever and hangs up, or they're like, we don't accept that insurance. And I'm like, you're right here on the website. And they're like, I don't know why. We've never just, so I have no idea. -4.
7. So out of 100
So
places where they actually talked to somebody, only 7 took the insurance and were willing to book an appointment,
I would have guessed like way higher than that.
right?
I would have guessed like 50 or 60 or 70% at least.
So that's what a ghost network is, and it's becoming a really big problem. And that's why mental health parity, this piece of compliance, is coming into the limelight as much as it is, because a lot of carriers have these ghost networks where they're like, oh, we have, thousands and thousands, but nobody can get the care that they need. And then they're obviously frustrated because it's their time of need and they're being, they made 93 phone calls. Like no one's going to do that either, by the way.
Hmm.
So what actually needs to be equal under mental health parity? It needs the financial requirements. So not only deductibles, copays, coinsurance, the treatment limitations, this one here, access to care, that's where we're talking about that network. So if you have a super robust network for PCPs and specialists, but you've got 7 out of 100 that are actually working, right? That's not equal. Prior auth, you need to have the exact same requirements, and then out of network. That's another thing. I was going to go into No Surprises Act today, but I think we'll just save everybody the compliance. Let's talk a little bit about common employer pitfalls then. So, despite really good intentions, many plans are still falling short. So, employers, these are the things that you should watch for, and maybe even consider doing like a little audit of your own after this. Look if you have more restrictive prior authorizations for mental health and substance abuse disorder versus medical care. Check if you have narrower provider networks and less reimbursement for mental health. This is really the big one that we're seeing a lot of issues in. And actually, this too, different step therapy requirement for medications. So, step therapy would be an employee is prescribed a drug. The insurance company says, I want you to try this, this, and this before you get that. That's step therapy. So let's say for a cancer drug, they only have 1 step, but for a bipolar drug, they've got 3, things like that. And then there's a thing called an NQTL, that's non-quantitative limits. There's an analysis that you can do on your mental health benefits under mental health parity that will basically ensure that you're in compliance. This analysis is actually something that starting in 2021 with the Consolidated Appropriations Act, it is something that is required by employers to do. I will tell you, we recommend it to employers. It's very expensive, and we're not seeing a lot of employers, unless they're usually, 1,000 to 5,000, 10,000-ish employees, actually making the investment in doing it, but instead doing maybe their own internal review, checking with their carrier, their TPA, their broker, their advisor, doing as much as they can before actually taking the action of having a third-party audit. But if you have questions on that, talk to me. I've got a lot of insider information and can connect you to people who can do that for you. But the DOL is like audits are definitely increasing. So if you're a plan sponsor, these are the things that I would recommend you do right away. Confirm parity compliance with your insurance company or your TPA, depending how you're set up. You can also just shoot an email over to your broker and be like, hey, I assume you guys took care of this during, our implementation and took a look at our plan design and all those things. Request a comparative analysis. That's that more costly study that I was talking about. So that is something that you can do. Usually it's done by compliance firms. Reviewing the provider network and reimbursement standards. I think that would be where I would start if I was an employer listening to this. And then auditing EAPs and carve-out vendors to ensure that they also meet parity. So if you've kind of been relying on, there's all sorts of EAPs and mental health vendors out there. If you've kind of been relying on them as your mental health coverage as opposed to your actual health plan design, you do need to do that comparison still and make sure that that's matching over here as well. So actionable takeaways. Johnny.
Yeah, this every time I think about the benefit of doing something earlier, I just think about I use the AAA example. I know for a long time my my parents were big believers in like having a AAA card because they're like, you never know when you'll be on the side of the road. And I was always like, couldn't be me. I see people on the side of the road and that never happens to me. And I think that's a big misconception that people have. Sometimes if you're in benefits or in leadership and you're like, that hasn't really touched me or hasn't really touched my family, I find that most people with lived experience, either firsthand or like with a friend or family member, they totally get everything we're talking about. And I think for people who haven't, it's not as intuitive. So the way I think about it is like, man, ideally no car breaks down, but that's not the world we live in. And
Right.
I want to encourage people that if you have like sort of penny pinchers standing in your way, there's math to show that it's an extraordinary investment. If you have people who are more concerned about morale and culture and the sort of net promoter score of like how the employees feel working there, there's data to back that up. If there's people who care more about churn and turnover and retention and like attract talent attraction, there's math there. So what I'm trying to tell you is if you if you get it because you've been through it, that's awesome. If you are in a decision making room with people who don't quite get it, but they care about any of these other things, there's data to support all these other things. So, what I try to tell them is like, it not only is there math and science to back up whatever that person cares the most about that supports this, but also if we can just be practical, we all know that this is how health works. And I always try to tell people that if you're in a position right now to make a decision that changes the lives of hundreds or thousands of people, I wish I didn't have to. We didn't have to do a whole presentation to be like, this is how the maths, but the math does math. And I think if you think practically about what your workplace will look like 3 years from now, 6 years from now, 9 years from now, because you make a decision like this, I think it makes sense. And I think we've overthought it. That's my point.
I agree completely. I think the other really important takeaway in this is if you can get into a healthcare strategy that is giving you access to data, right? So, like, I could tell you we've had close to 600 visits. This is the average claim. This is how mental health plays in the bigger total claims picture. We have that information because we are in a transparent health plan that gives us to the penny accounting on our data. There's probably a lot of you on this call that get, you get your renewal and you've got 2 pages. It says you had crappy claims. Good luck. You're not seeing that data. You're not seeing those numbers. And to Johnny's point, there is a lot of outside data that you can use to tell that story. But what's even more powerful is to be able to go back to this client 3 years later and say, hey, remember 3 years ago when you said you wanted to be the best mental health employer in the state of Florida? Look how you're trending. Like, these are the things, and it's your actual data. So I think, there's two things. If you don't have access to your own data, then tell the story of everyone else's data, and then also get into a better plan design where you can access your own data and then tell your own story. I think that's the most powerful thing that you could do. We have a couple of things here listed as well. So, it's probably a good idea to just take stock of your current mental health benefits. If you're coming up for renewal, take some notes of things that you might want to consider implementing. And then really ask yourself if we're putting up all these barriers to care, which let me talk about things that make you mad, Johnny. Like, that is one of the most frustrating things to me in the entire world is when the strategy to lower cost is to make things harder to get, right?
It's rebate strategy, Chelsea. Like, oh, save $75, and then you have to like go to the North Pole to deposit it firsthand. It's like, oh, had I known that.
Yeah, 100%, right? Like, or Yeah, just add in all these prior auths or make it really hard for people to get expensive meds that they absolutely need.
Yep.
Like, why not, instead of doing that, or increase deductibles and increase out of pocket and narrow the network? Those are band-aids, those are not fixes, and those do not serve your employees. There is actually a way where you can give them all the things, whether it's free mental health, free specialty drugs, free cancer treatment, do the right thing and save a lot more if you're in the right type of system and the right
Mhm.
type of plan design. So take stock. Do we really need these barriers? As you can see with the population that I shared, it's not that expensive. That ROI was huge, actually. And then mental health parity, don't let it sneak up on you. It's definitely one of those compliance items. Like, we're always thinking about 5,500 and ERISA and ACA reporting, and that, RxDC reporting we just did July 1st. That's everything drugs. Mental health parity, it doesn't really have a deadline. It's just like you might get audited one day. So don't let that sneak up on you. Ask your advisors, ask your TPAs, ask your carriers. Right. That was fun. I'm like out of breath. I was so excited.
Yeah, I like doing it with someone who like obviously I've been to a lot of webinars and stuff, and some people are just so like they drag on. You can tell they're so bored with it, and you and I are not that type of person. So I hope people are enjoying it as much as we are.
Yeah, I hope so too. And guys, we are going to send out the deck, absolutely. And then if Johnny has any other resources he wants to, we'll share as well. There were some questions in the chat about caregiving benefits, and I've had a lot of conversations recently about people who have family members that are going through really hard times, whether it's cancer treatment or hospice, things like that, and their personal mental health as a caregiver is suffering. So I'm going to see what resources we have to include that in the email tomorrow. But if you want anything, Johnny is your mental health guy. I can help with your healthcare plan design and ideas. And like he said, it's less about working with us and more about, like, let's just advance this mission of bringing better healthcare and mental health benefits to as many American employees as we can. So thank you so much for joining us. And Johnny, you were a great host. Thank you for doing this with me.
I'm so grateful we got to make it happen, and thanks to everybody who just spent their hour with us. We know you could be doing other stuff and choosing. I'm a perpetual student. Like, my heart is like, I love reading and like watching TED Talks and listening to podcasts and stuff. So I appreciate that everybody spent time here. Like, I want to learn something.
Megan, did we have any questions that we should try and ask, or are we good to let everybody go? And feel free to log off at this point. If you...
I think we just, we had a couple of kind of people that were echoing a little bit of what we were talking about with EAPs and barriers to use and things like that. But no real questions other than I think what you had mentioned, Chelsea, with support for caregivers and things. So that you mentioned.
Okay, well, keep your eyes open for an email tomorrow. And again, thank you, everyone. We hope you have an amazing rest of your day.
Thank y'all.